Good evening, everyone. Welcome to our webinar hosted by Physicians Preference Pharmacy. Tonight, we're going to be talking about Mast Cell Activation Syndrome. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. And for those of you who are guests of the Hotze Health and Wellness Center, I want to welcome you. We also do have some on here that have considered becoming guests at some point in the past, so they're invited to also attend this webinar to see if anything resonates with them. And of course, I'll extend an invitation at the end of this webinar for you to become a guest with the Health and Wellness Center and show you how to do that. But this evening, I'm going to be speaking on behalf of the pharmacy. So at Physicians Preference Pharmacy, we compound a lot of different products for this specific syndrome that we're going to be talking about this evening, which is Mast Cell Activation Syndrome. So this is something that I personally decided to begin diving into a few years ago, partially because I was speaking with a lot of our guests on the phone. And for those of you that don't know, the pharmacy does ship out to 49 states. So we serve a lot of outside guests who see outside providers and have different specialties. So I do interact with many different physicians and guests across the country. And what I was seeing across the board are very interesting, unique, difficult to treat, treatment-resistant symptoms showing up. There's absolutely no doubt that the COVID-19 pandemic had a major effect on people showing up with symptoms that are synonymous with mast cell activation syndrome. This specific webinar is going to be a little bit different in the fact that it will have much more of a clinical focus. And we're also going to, of course, talk about some of the compounded prescriptions that you can obtain from physician's preference to help with the symptoms of mast cell activation syndrome, which we call MCAS. But one of the things that I think is really important is that we always understand how to identify when our body's out of balance. We trust our physicians and our pharmacists and our healthcare team to identify those symptoms and to make sense of them and to give us a treatment plan. But one of the things that makes MCAS unique is it waxes and it wanes. It changes day to day. And generally, someone who has a diagnosis of MCAS will show up to their doctor's appointment looking different every single time. So it makes it very challenging for the physician. And it's very important to have a physician and people on your healthcare team who can afford to spend the time with you if you have those symptoms that are synonymous with MCAS. So strap on in because we have a lot to cover this evening. Please feel free to take notes or to just passively listen. I'm going to start sharing my screen now, and after this presentation, I'll go ahead and take questions. And also for those of you that are registered for this webinar, you will be receiving a replay. So if you just feel like you want to more passively listen and take in the information, it is a lot. And for those of you who have listened to my presentations before, I do like to make my PowerPoints content rich because you have some takeaways here during the live interaction, but you'll also get this set of PowerPoint slides. So you can always go back and you can dig in as you please. So let's go ahead and get started. This is absolutely one of my favorite topics to talk about when we're focusing on a condition or a clinical presentation. So we're going to be covering MCAS, Mast Cell Activation Syndrome. And the reason I have an iceberg here as my picture is because this is how MCAS presents itself, or can be very tricky in not showing a lot of its ugly heads not raising above the surface. So although we see a lot on the surface symptomatic wise, there's so much that goes unrecognized and undiagnosed. So if you or someone you know has repeatedly been told the symptoms are all in your head, or I'm sorry, I really can't help you, then this talk is for you. So let's go ahead and get started. We have a lot to cover. First, I always like to cover what the pharmacy does, who we are, what we believe, for those especially that do not fill prescriptions currently with Physicians Preference Pharmacy. So we are a compounding only facility. We make non-sterile preparations only, which just means that that affects the different types of dosage forms that we make. So essentially, we don't make injectables, we don't make IVs, and we don't make anything that goes in the eyes. We do specialize in hormones, of course, that is the basis of our practice, but also we really focus on providing clean, pure, with minimal ingredient, immune balancing compounds. So products that are going to bring the immune system back into balance. In this case, we're really going to be focusing on products that calm the mast cells down. All of our preparations are free of any unnecessary dyes, fillers, lactose, cheap fillers, artificial sweeteners, basically any of that junk that you just don't need in your compounds. And we do hold PCAB accreditation, which means that we abide by stricter standards. The potency must always be tested and verified with anything that comes from our laboratory, and not all compounding pharmacies go through that rigorous testing, as well as rigorous and routine inspections to verify that we are doing what we say that we are doing. And again, we do ship to 49 states, whether or not you see another physician or you see us and live in another state. So for us to grasp everything that mast cells do, we have to understand what they are. So if you've never heard of it, you're not alone, but mast cells are innate immune cells, which essentially are white blood cells living in nearly almost every single tissue within the body. So this makes them very unique because they're very interactive with a lot of different organs and systems in the body, which we're going to talk about tonight. They're found densely in the GI tract. So when we think about where these cells are present, we should also be thinking about the certain symptoms that show up based on where these cells spend most of their time. So we find a lot of them in the GI tract, in the gut, the lining of the airway, as well as on the skin. And we know that our skin is the largest organ in our body, on our body. Mast cells, they're good. They protect us from infection. They produce allergic reactions, which we usually think, oh, that's not good. But if we didn't have reactions to things that we are allergic to, then eventually we would die from that kind of response. So it's kind of a messenger to the body of, hey, that's not right. You need to stay away from that. So it's a signaling agent. Also, this picture that you see here on the slide, this is a very magnified image of a mast cell. And then you have these granular sacs. So these dark circles are actually sacs that are in the mast cells, and they have granular contents. What I mean by that is they have a bunch of mast cell mediators, which means that the mast cell is extremely interactive. It interacts with everything in its environment. It's like the social butterfly of all cells, and it releases a lot of things. So when anything interacts with it or binds with it, then it starts releasing things like crazy. And so this is when it's uncontrolled, this is when it becomes a problem for us. I have bolded several things throughout these slides because I want them to pop off at you and so that you can actually see some of the trends that we're talking about. So mast cells release histamine, they release heparin, they release platelet activating factor, things that affect cardiovascular circulation and how our cells communicate with each other. Let's remember that mast cells are necessary for appropriate immune response, so a balanced immune response. And I just want you to know that the cell's biology alone virtually guarantees multi-system complexity, meaning it's so complex and it's in all these different systems like the lymphatic system and the cardiovascular system that it's very interactive across the body, which is what makes it hard to diagnose and identify, which is why so many people get turned away from their physicians because they say, I don't know what's wrong with you, or I don't know how to help you, or it's all in your head. And I don't like hearing that, which is why we're opening up the conversation about this tonight. So where do mast cells live? Again, where are they at? What are they interacting with? They are located pretty much everywhere. The skin, the eyes, the ears, the lymphatic vessels, the GI tract, the lungs, the bladder, the blood vessels, the nerves, the muscles, the tendons, the ligaments, the bones, and the brain. So they're very interactive based on where they live and what they do. So what do they respond to? We keep talking about how interactive they are. Well, they react or respond to everything we breathe, everything we swallow, everything that touches our skin. Anytime we're stressed or we experience a stressor, meaning anything that just kind of shifts the body out of its normal, hormones, injury or trauma, anytime we take in a medication or a supplement or anything in our mouth, Non-visible things like EMF or Wi-Fi, pathogens, that goes for viruses, bacteria, etc., molds, mycotoxins, antigens, those that have mold allergies in particular. Basically, the bottom line is this is not an extensive list. Mast cells have over 200 different types of receptors on their surface, which makes them so interactive with everything around them. So what is this? This is a picture of a castle, and basically this is kind of like castle or castle guards or people that are around the castle, and the castle is your body. These people surrounding, I think of them as individual mast cells, or they are constantly surveying what is going on. And the mast cells really have one overarching job, and that's to ask this question: am I safe? Is the body safe? And if the mast cells perceive a threat, boom, then they go into action, and that's fine. But if they don't stop going into action, then we have a problem. Just like anything that's turned on chronically in the body, that eventually will cause an issue for us. So let's talk about MCAS. We talked about mast cells, but MCAS is Mast Cell Activation Syndrome, meaning that the mast cells are overactivated, overstimulated, overly sensitive, hypervigilant, overresponsive to the point where it becomes a syndrome. The word syndrome is what we use clinically to describe somebody who has a lot of different symptoms. So when you have a collection of symptoms, now you have a syndrome. And then usually those syndromes get names like MCAS. So MCAS can happen for a few reasons. The 30,000-foot view is either that you have so many mast cells that there's a lot of activity of them in your body, which is very uncommon. This is a genetic thing. Or they're overreactive, which means that something has stirred them up, made the body very unhappy, and now you're having a hard time getting out of that tailspin. So MCAS is a collection of symptoms which underlies many of the common quote unquote unknown diseases, what we call idiopathic, that you might be experiencing. Or when the physician says you have idiopathic this or idiopathic that, all that means is you have those symptoms, but we don't know how you got them. And we're trying to answer those questions tonight. So who is MCAS? Who has MCAS? Well, just to kind of give a perspective, about 17% of the general population actually, and nearly 40% we think of obese patients suffer from MCAS. So symptoms can appear at any age. That they can be very common in adolescents or children. However, the diagnosis usually doesn't come until very late in life because physicians are not recognizing what's going on. So it's well, I've just been like this my whole life, or I've been very sensitive my whole life. I've been triggered by things my whole life. I've been sick my whole life. I've had a lot of infections my whole life, but no one can answer the question for me. MCAS is chronic. So again, at diagnosis, many times people have been ill for years. The thing that also makes it very difficult for physicians to identify is that your symptoms can completely vacillate doctor's appointment to doctor's appointment. And that makes it hard for them to kind of put a target on it. Now, no system in the body, cardiovascular system, lymph system, immune system, no system is immune from MCAS, not even the immune system. And in fact, the immune system is probably one of the most affected systems because the mast cell is a type of immune cell. It's a white blood cell. Those with MCAS may be those that are allergic to everything. So these are those people that if you do fill with our pharmacy, you know, on the front end, we ask for a list of medications or supplements that you're currently taking. 100% of the time that someone comes to me and they have a previous diagnosis of MCAS and they start filling with the pharmacy, they go, oh, it's too much to list. And too much to list is usually somewhere between 40 and 100 different supplements. We see it frequently, and they may be on a handful of medications. Medications are not usually well tolerated. So typically people with MCAS are on a lot of supplements to control the symptoms, but not all their symptoms are taken care of because they can't tolerate the medications that they need to keep the symptoms under control. This is very frustrating. Or you can have the person that would be considered picture perfect, especially when you look at their labs. Nothing is out of range on their labs, but they literally feel horrible. So we have bookends. Again, one of the reasons it's very hard to kind of pinpoint these people. Now, the severity of MCAS, this is really important. It permanently steps up a notch in severity each time that that person experiences a stressor or a traumatic event in life. So it makes it very hard to gain traction in improving if we're not stress resilient. And there's a lot of things that play into stress resilience. So some of the constitutional symptoms of MCAS are, oh, I just feel awful in general, but then they appear again to be the absolute picture of health. The labs are perfect. Some really common ones that we hear are temperature abnormalities. So I'm cold most of the time, or maybe I even have a low-grade fever, and then spontaneous sweating. Severe fatigue, unable to get out of bed, and oftentimes this will wax and wane. Unprovoked sweating. Oftentimes this will occur more at night, and it's very common on the back. So especially following meals after eating, then breaking out in a sweat on the person's back. Frequent fluctuations in weight that can be due to bloating, due to edema, so really severe swelling that doesn't go down for days. And of course, that raises the number on the scale because you're holding on to water. And then itchiness. Itchiness is a big one, and we're going to talk more about histamine, but itchiness in those with mast cell activation syndrome is very common in different areas around the body. One of the most common areas is on the anus. So the anal opening, no one's really going to come into the doctor's office and say, hey, guess what I've been going on lately? However, it's an important question to ask because typically the answer is yes, I do have anal itching. And oftentimes it can be exacerbated by access or by coming in contact with water. So it could be aquagenic, but usually it'd be worse if it's exposed to hot water. So maybe during a shower even, or a bath. All right, here are 7 common root causes of mast cell activation syndrome. Number 1, and these are not in any specific order. Number 1, food triggers. Not just foods that are high in histamine. We'll talk about why high histamine foods are important because I talk about histamine a lot when I talk about MCAS. Infections and toxicity. So common ones include Lyme, mold, household products that could be like cleaning products or laundry products, soaps, those types of things. Having candida overgrowth. If you are a guest with us and you feel with the pharmacy, you know that once a year at least, we recommend that our guests go through the yeast-free eating program. And the reason why is that is to address candida or yeast overgrowth in the gut, but also that's made its way into the blood, which that can lead to food allergies. So we want to be sure that we don't have excessive yeast overgrowth happening in the gut, which is one of the most integral parts of maintaining a healthy immune system. And then also COVID now makes it on the list because we're seeing a lot more people that have either had the COVID shot or had repeated COVID infections, have just wild mast cell activation syndrome symptoms, and oftentimes that's accompanied with POTS. Genetic factors. So this can really have a large interplay with how someone detoxifies and how they manage inflammation. Nutritional deficiencies, definitely affected by having, again, a weak gut, a leaky gut. Hypoxia, that's the word for low oxygen. So we can have low levels of oxygen in our blood, in our tissues, and where we want it to be for a few reasons. This reason often goes unseen or undiagnosed, is that simply the airway, our airway to breathe is restricted. So sometimes we just think about that as being more of a nuisance or being lightheaded or not being able to walk so far as I'm short of breath. But what about actually having a physical constriction of the airway? A lot of times what we find, and this would be a really important part of talking about MCAS, but it's its own topic on its own, is biological dentistry. And biological dentistry is a specialty of dentistry or a style of practice of dentistry that is kind of like the functional or integrative physician, but of dentist is how you can think of that. Now, when you go to biological dentists, they are certified in particular ways about how to remove mercury amalgam fillings from the mouth, but also how to structurally improve the mouth and the construction of the teeth so that the airway is not crowded by the crowding of teeth in the mouth, which then pushes the tongue back into the throat and blocks the airway. So we have to think, why are we really not getting enough oxygen? A lot of times by improving that, by going to a biological dentist and having them help you with this, then it improves the airway size, you get better oxygen delivery. But low oxygen is not good in cases of MCAS. Hormone imbalances. This is a really complex topic because it's kind of a catch-22. Those with MCAS have hormone imbalances, but hormone imbalances can also cause MCAS symptoms. And estrogen and cortisol are two particular hormones that we really think about being imbalanced in MCAS. Also stress and trauma. So particularly childhood stress, having consistent or chronic fear or childhood trauma or fear being unresolved. This is kind of the last leg in healing. A lot of times I find that people have done everything that they need to do, doctor-wise, nutrition-wise, medication-wise, supplement-wise. They're just not healing fully. And if we trace their medical history back, life history back to a specific traumatic event where they started to see a change in their health, until that's actually resolved, they will never heal fully. So there's a lot of ways that that can be done, but a lot of times that will be kind of the rate limiting step at the end. So let's talk about some of the other symptoms that we see. So the integumentary findings, that's hair, skin, nails. Mast cells are largely present in the skin, including in the hair, in the nails, in the sweat glands, the sebaceous glands, the nerves in the skin as well. So think about having a lot of rashes, flushing easily, and also rashes moving from place to place around the body. Like today it was on my left arm and tomorrow it's on my stomach. And then the next day it's on the back of my leg. This is pretty common. Again, hard to pinpoint that when it's moving around. The hair generally is brittle, dry, and goes through cycles of thinning or loss. Nails are usually brittle, breaking, having ridges, white spots, or what we call Janeway lesions as well. And then also sun intolerance. I highlighted this because this is a big one. People find it to be very strange, but it oftentimes can pinpoint that there is some sort of overactivation of the mast cells happening because you have so many mast cells in your skin that when you go out into the light and into the sun, they're photosensitive. And so then again, they start reacting. Typically, when people are exposed to sun, they come in and they're exhausted, like something was just taken out of their body, like their cup was emptied and all they did was they went outside and they were exposed to the sun. Oftentimes, major rashes will occur following sun exposure as well. So what about the eyes? Very common for people to say, oh, I feel like my eyes are always burning, or they're sandy, or they're dry, or they're kind of gritty. We have over 50 million mast cells in the tissue surrounding the eye alone. So again, very reactive. My question here, a couple questions are, do we think that those quote unquote idiopathic or unknown cause eye diseases maybe are being driven by MCAS? We know that when conditions show up, when illness is chronic or persistent, it always has some sort of underlying inflammatory reason why that's happening, or irritation. So I think the question is, well, with so many of these types of cells being there, is something being aggravated in those cells, which is maybe causing glaucoma, loss of vision, that type of thing. So we want to think about that, conjunctivitis, whatever this might be. Also, what about this? Do we think that maybe histamine or some of those other mediators that are being released from those sacs in the mast cells are being released out into the eye and then causing irritation? I think probably it's causing that burning, sandiness, kind of gritty filling in the eye. I do want to point out that although this is not always an option for people, physical relocation from either a workplace or the home, whatever is causing that trigger exacerbation, physically locating to another place usually provides substantial or almost complete improvement of the eye-related symptoms in many cases. All right, what about the sinus and the nose, sinuses and the nose? So this is a pretty common one because sometimes you will hear physicians that are, I'm going to say, kind of practice with an older mindset, saying, well, okay, well, it's just allergies, or, we know that the mast cells are important and they play a role in allergic responses, but it's just allergies. Well, there's so much more than that, because again, these cells are very interactive. So environmental allergies absolutely are mast cell driven, but then we get this whole set of symptoms that comes up in the nose and the sinuses. And usually people are feeling very junky in there, a lot of congestion, postnasal drip, not uncommon to get nosebleeds for just unknown reasons. Part of the reason why is there's a very rich network of blood vessels and mast cells in the nasal passages themselves. So when they start overreacting, then that produces blood flow, bloody nose. So rhinosinusitis, inflammation basically of the nose, the nasal cavity. This is, I think, an important thing to keep in mind, because MCAS, as we're seeing, is very complex, and it usually is synonymous or shows up with other issues too. So it's very common for those with a Lyme disease diagnosis to also have mast cell activation syndrome. That being said, if you know anything about Lyme, you know that antibiotic treatments are a standard for that. You kind of can't proceed without it. There are a lot of techniques that we use to minimize antibiotic use, but it's really not something you can dodge. That being said, if you're someone that's on routine antibiotics, or if maybe someone, like, say that you've gone to an allergist or you've gone to a general practitioner, and they said, well, maybe it's a sinus infection, why don't we just try to give you some antibiotics? It's very important, hear me loud and clear when I say this, that MCAS-driven inflammation, so when the mast cells are stirred up, they're causing inflammation because of everything that they're spewing out of those granule sacs, causing inflammation, let's say in this case in the nose or the sinuses. That inflammation caused by MCAS is typically sterile. And if it's sterile, there's nothing to clean out with an antibiotic. However, it's really common to just give an antibiotic for something like this or symptoms like this. So when that inflammation calms down, sometimes the physician may misconstrue or misinterpret that as, well, I guess the antibiotic works, so that was good. But guess what? The next time that happens again and you get an antibiotic, it either might not work, or you're just increasing your chances for antibiotic resistance, which none of us want. So the inflammation that the mast cells cause, it's sterile. It's not causing an infection. A very important note there. All right, so oral or pharyngeal findings are usually very prominent in MCAS. We'll start with the teeth. Teeth usually crumble years prematurely despite having great hygiene, literally crumbling in the mouth. Burning mouth syndrome is something that is very interesting, especially for women around menopause. So perimenopause, when we're transitioning into menopause or even into postmenopausal years. The reason why is there is a hormonal component related to it. But essentially, if you imagine your tongue and your gums literally being on fire, like burning, that is what burning mouth syndrome feels like. So in MCAS, without having other underlying issues that may actually cause these types of oral symptoms, what's happening is one or more of those mediators that we talked about that are being released from those sacs in the mast cells, like histamine, for example, are either being released from the oral tissues, which causes inflammation, or that irritation is activating the nerves in the mouth. So it causes the sensation of pain, even if there's not, let's say, an injury or an infection that's present. So mast cell disease either is actually happening in the oral cavity or in the oral tissues or in remote sites, but it's kind of this referred pain to the mouth. But either way, it causes this degradation of tissues. Like you can see in this kiddo's mouth here, it's just kind of a raw tongue, or it allows for opportunistic infections to occur. So when we think about doing a candida cleanse or a yeast cleanse, essentially what we're trying to do is we're trying to get rid of the yeast overgrowth. This looks like yeast overgrowth on the tongue. Now, anything that touches the tongue, you swallow through the throat, goes into the gut, that's all connected to exactly what we're trying to address with candida overgrowth. So this is a good sign that something is starting at the first step of the digestive process, but not really working to calm the immune system down, but instead we're getting this overgrowth of some of these yeasts and other things that we do not want, especially in the mouth. Also, this is a big one. So I don't have a diagnosis of MCAS, but I do think it's important to share that I've experienced a lot of these symptoms of my mast cells being overactivated. And the reason I know that, and I actually had to figure that out myself, is because I've dug into this so deeply over the last few years. And I know now what it feels like to be triggered and what my personal symptoms are. I definitely went through a period where before I kind of knew what was going on or what was triggering me in foods is I would have that sweating on my back following a meal. And what's very crazy about that is all you're doing is eating. Now, when you start sweating on your back, it kind of gives you this panicky feeling. Now it's really all connected, but then you start thinking in your head, well, what's going on now? Why is my heart racing? Now I really feel like I'm panicking. This is a very common experience for those whose mast cells are overactivated or who have MCAS. That's why we have to take a very thorough history. We have to really be very aware of what's triggering us so that we can cut those things out. Now I've done that. Now I don't experience the back sweating anymore after I eat, which is a much more pleasurable experience. That being said, also part of the oral or pharyngeal issues that show up is excessive mucus production. And it's not necessarily the kind that you would hock a loogie, so to speak, or spit it out. It's the feeling that there is this mucus or this something stuck in the back of your throat. So you're constantly swallowing, because it feels like it's stuck there, but nothing really ever goes down. So that's something that I was also experiencing as well. And you just feel like you're constantly swallowing all the time. Okay, so what about the lungs? Another area that I really actually still continue to experience symptoms in, especially as the seasons change. So I'll share some of my personal experiences of what's worked for me when we get to the medications. But what about respiratory tract findings? A lot of times we'll hear, I just cannot catch a deep breath. And we'll see migratory flares of swelling, which means that the swelling will happen in different parts of the lungs, or it will some days and not others. Bronchoconstriction. So these purple areas here, these are the bronchioles that supply really, nerve sensations and blood and all the good stuff to the lung tissue. But if they constrict, then we don't get enough air to the lungs, and then that's when we can't catch a deep breath. One of the tricky things about the respiratory findings in MCAS is a lot of times, if you've ever been into the pulmonologist or the allergist and you've had to take a spirometry test where it's this kind of, I don't know, this handheld device that you breathe into, what they're testing is pulmonary function or lung function. They say, blow, 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 blow harder, blow harder, blow harder, because they're trying to have you get all of the air out of your lungs to see what your lung capacity is. And then there's equations that they run with your age and all the other information to see if it's what they would expect it to be. A lot of times these pulmonary function tests, how much you're able to blow in and really deplete your lungs of oxygen during that test, will be perfect. And this was my case too. I mean, they're saying you have the pulmonary function test of an athlete. It's perfect. Okay, but I don't feel that way. I feel like my lungs are spasming, really is the way that I felt. So it doesn't always add up with the way that we're feeling inside. Really common to be hoarse, have a dry cough, or even wheezing. That can often get diagnosed as asthma, even if it's not truthfully asthma. And then the mast cells play a role in the development also of things like COPD and interstitial pulmonary fibrosis, so hardening of that pulmonary tissue. Let's talk lymph. So when we see these green little spots along the body or these green lines, if you look into a textbook, you're always going to see the lymphatic system outlined in green. Now you have these nodes. So you've probably heard of lymphatic nodes, especially in the axillary area, which is underneath the armpit, is very common. Also here underneath the chin, all the way up to the ear. We have the cisterna chyli, which is right there underneath the sternum. It sits right there, and that's where a lot of our lymph dumps as well. But of course, it's meant to circulate throughout the body. So really, the lymph is a very intimate system. And what I mean by that is it sits very closely, especially to the vascular system, so that they can exchange their nutrients and their contents and their toxins, because the lymphatic system is the sewage highway of the body. Its goal is to pull toxins out of all the other systems and then get it out. But usually with those that have MCAS, the lymphatic system gets totally jammed up, which is why you feel like trash, because you do have this excess trash and toxin buildup in your body. So if it doesn't have anywhere to go, then what's it going to do? It's going to back up. It's going to enlarge. So you may see lymphatic enlargement, but also this can change. Again, moving target. So it's going to wax, it's going to wane, it's going to migrate. Sometimes you have lymphatic enlargement here in the neck, and then the next day it's in the leg, and then it's in the belly. So it's very hard to keep track of. And also, mast cells influence lymphatic permeability. So if you think about the lymphatic system being this closed system, so to speak, only so much can fit in it. So when only so much can fit in it and it's really being maximized, then eventually it's something has to give there. And so you're going to get toxic leakage into the other tissues, the surrounding tissues. But because mast cells can cause inflammation, it can also affect how well the lymphatic system drains into the other systems to get it out of the body. So there are a few ways that our body typically detoxes. That's through the urine, it's through the stool, and it's through sweat. So we have to think of at least these three major ways to get toxins out. And oftentimes in MCAS, we have to get really creative, because if I ask you to go out and go for a run, or maybe even just go out into the sun and sweat, again, remember, there may be sun intolerance associated with that, and that's just not going to be an option for you. So I really can't do that. All right, neuropsychiatric findings in MCAS. So if you've heard it's all in your head, then the reason why this can happen, that in MCAS we can get a lot of neurological issues showing up, is because there's really extensive crosstalk between the nerve cells and the mast cells. So we get this numbness that kind of comes and goes. We might have memory or word recall problems, trouble concentrating, also anxiety, panic, fluctuations in mood, depression, feeling like we're paranoid, feeling chronically weak, having chronic fatigue syndrome, or even changes in some of our senses like hearing, vision, taste, or smell. Now, I wanted to point out here that the FLCCC, which is the Frontline COVID-19 Critical Care Alliance, they have a lot of protocols that they have come out with, especially for long haul COVID, or those that have had COVID for many years or extended symptoms since the COVID infection. What I've highlighted here is essentially they're saying that mast cell activation syndrome is a main trigger to releasing things like histamine and causing chronic inflammation. You may have heard people talk about brain fog related to COVID, or what they call COVID brain, causing cognitive impairment. The reason that this continues to happen, and I know if you don't experience this, you know somebody who does, so please share this information with them. The reason that that brain fog persists is because the mast cells in the brain have been so overactivated and they're not calming down. So it's inflaming the brain tissue. I've heard some people explain it with MCAS that they feel like their brain is too big for their skull. So literally there is that much inflammation. And yes, that's going to cause a lot of brain fog. All right, so what about the immune system? The entire immune system is affected by MCAS. Infections get to be more frequent, more chronic, and we do know that the SARS-CoV-2 virus does hijack many systems in the body, but essentially it causes chronic inflammation, which will lead to MCAS, and oftentimes will lead to cancer, and these three are connected. So we want to be very careful as we decrease the inflammation and support the immune system in mast cell activation syndrome, so that we can decrease any chances of developing cancer. All right, so histamine. I do want to talk about this because it's very, very important. Histamine is an essential messenger that we have to have in the body. So usually when we think of histamine, we think of, oh, antihistamine medications. So we might have the perception that histamine is bad, but it's not. It's necessary. It's important for widening the vessels to improve blood flow, for releasing hydrochloric acid in the stomach for digestion. It's also a chemical messenger to the brain. It partially gets us excited, wakes us up. And so it's neuroexcitatory. But one of the things that we should note about histamine is that when you wake up in the morning, your histamine is likely at an all-time low. Now, there are a lot of things that go into your histamine bucket, which we'll talk about, that increase it throughout the day. So by the time you get to the end of the day, your histamine bucket is full and it's at its all-time high, which is why a lot of people can't sleep and why antihistamines help them sleep, because it's breaking down the histamine. Histamine intolerance typically arises when 2 or more issues are present, and oftentimes that's either the gut, the hormones are out of balance, or some sort of a food trigger, for example. So a lot of times people will say, well, I have hives, but I have no idea why. Or I have migraines or unexplained congestion, or my heart is racing following a meal. This is how I know when my mast cells are overactivated, because this does happen to me. So this is why I've cut certain things out of the diet, and I take some of the products that I'll be talking about to help calm that down. This is what we call dermatographia. So if this person here in particular has itched the skin, and these red marks are long lasting. So those maybe should go away in 5-10 minutes. I don't know, depending on how hard the person's scratching. This might be 30 minutes. This might be hours later where it just does not go away because the histamine production is so high. So when we talk about histamine intolerance, MCAS is probably the #1 driver of that. Just like when we talk about insulin resistance or histamine intolerance, it means that there's been too much of it and the body doesn't like that, so it starts reacting negatively. Many things can affect it. Again, long list here, you can go back and read, but having gluten sensitivity, having gut infections, H. pylori is an important one to test for, candida overgrowth, inflammatory bowel disease, being exposed to mold. Any of these things can fill our proverbial histamine bucket. And that can be hormones, it can be stress, it can be allergies, it can be toxins in the environment, it could be unregulated or disbalanced gut bacteria. And you can see here that at the bottom of this bucket, we have 2 holes. And they actually have the names of the enzymes written in them, DAO and HNMT. And those 2 enzymes are responsible for helping to allow our histamine bucket to drain 24/7. Now, a lot of things are very interactive with those enzymes, including hormones. So if the hormones are out of balance, the enzymes don't work properly, our histamine levels build up, now we're anxious, now we have insomnia, now we have food allergies, and you can see where this is going. So just a few mention of high histamine foods. It's really important to work with someone who understands how to really tailor your nutritional regimen in a way that makes sense for you. But some of the ones that are most offensive to the body as far as increasing histamine are alcohols or foods that are prepared or packaged in vinegar. Here are 3 that really surprise people because they're healthy foods: avocados, spinach, and strawberries. The other thing too is watch your leftovers. The reason that this is important, especially if you live in Texas, Texas barbecue, long cooked meat, that's an important thing. And we know that the longer food cooks, or if it's like meat that is smoking, for example, or if it's been cooked in a crock pot and it's been cooking over several hours, then it begins to release more and more histamine releasing bacteria. And that even includes foods that have been in the fridge for several days that are leftovers. So be sure to watch that. There's an app called the Fig app, Food is Good, where you can actually scan the foods in the store to see if they have high histamine content or not. So we're going to spend the last few minutes here talking about compounded prescriptions, which is usually where I spend the majority of my time, but I think we need to understand what's going on so we can better control and identify our own symptoms as well. So most people don't need a ton of stuff. Usually they're on a ton of stuff when they have MCAS, but they usually feel better primarily by blocking histamine release, using low-dose naltrexone, LDN, and something called amlexinox, which is one of our newer but very successful compounds. It's really, really important. One of the most important things is to choose compounds, so compounded prescriptions, or supplements that have the right fillers in it, that they don't have bothersome fillers in it. And just hang tight for a few more slides and I'll show you what those are. Also, that the inactive ingredients are not going to be bothersome. And then typically you want vegetable capsules, because if you start getting into those that have a bunch of dyes and fillers, then you've just got too much going on, which are going to really aggravate those mast cells. Mast cell stabilization, calming them down, is going to be one of the main goals in stabilizing this syndrome. So we have several compounds on our formulary available to help those with symptoms of MCAS. But first and foremost, calming histamine. So we have a lot of antihistamines. What makes ours different is you're just getting the active ingredient and the minimal amount of inactive ingredients, and they're not going to bother the mast cells. A lot of times this looks like using sodium bicarb, which is baking soda, as the filler, because it's very inert and not bothersome to the mast cells. Some inactive ingredients that we would typically use are not bad for the body, but the mast cells sometimes don't like them. That's why we want to be sure we have the right types of preparations. Also, if you've taken antihistamines regularly and you're kind of familiar with the doses that are available over the counter, then you might think, wow, these are some really wonky doses. Diphenhydramine is Benadryl. This is a 60 milligram capsule. The little pink tablet with all the dyes in it that you'll get over the counter at Walgreens or whatever it is 25 milligrams. Most people max out at taking 2 of those at night. Now, when I was using our Benadryl that's compounded, diphenhydramine 60, I was taking 3 60 milligram capsules, which is 180 milligrams of Benadryl every day. But because it's slow release, it does not make you drowsy. So totally unaffected, normal energy level throughout the whole day, sustained, taking 3 of these throughout the day. But at that time, I was in a tailspin and that's what I needed. It's not uncommon to see we need much higher doses of products that work to reach a level that is therapeutic to actually have a benefit. So that's not uncommon. Now, you've probably heard of compounded sirolimus or rapamycin. We offer this in different strengths, but essentially what it does is it's like the trash guy that comes to your house and takes your trash away. So you, or let's say your lymphatic system, can take your kitchen trash out to the curb or all the house trash out to the curb, but it shouldn't just sit there. The next morning, the waste management company should come and take it away. When your cells are not good at that taking away process, then they need some help. And that's where rapamycin or sirolimus comes in to help to support cellular detoxification. We've seen some really good benefits in those with mast cell activation syndrome using rapamycin because it really helps to decrease brain fog, improve energy, and actually improve both the quality and quantity and regularity of bowel movements. So we have a huge toxicity issue in mast cell activation syndrome, and a lot of times that comes because of perpetual constipation. That's a big problem. It's very dangerous. So this will help to increase bowel movements as well. Now, if you're a guest of Hotze Health and Wellness Center, you know hormones are our staple treatment. We are big on choosing bioidentical hormones because we want to choose products that are similar to what the body makes on its own so that we don't have all these side effects from synthetic man-made drugs. Now, in times of estrogen dominance, which we talk a lot about estrogen dominance in the practice, when estrogen and progesterone are not balanced as they should be in the appropriate ratio, estrogen balance can cause a lot of issues, but also in MCAS because the mast cells have receptors on the outside that interact with estrogen. So as you can see, and as you know, if you're a woman, is our hormones are always fluctuating, not just on a daily basis, on a weekly basis, of course, on a monthly basis. And so depending on where you are at here in the cycle, you're going to have some times where your estrogen is naturally higher, or you're going to have some times when your progesterone is naturally higher. In those times when estrogen is naturally higher is when you typically have more hormone-related or mast cell activation syndrome-related symptoms. So the headaches surrounding the cycle, that type of thing, even breast tenderness, So these are all ones that we want to be sure that we are giving enough progesterone to help balance out some of that estrogen dominance that can get sky high and out of control. And what I put here are different formulations that we make for progesterone. If you have mast cell activation syndrome or some of these symptoms, you're going to want to stick with a slow release preparation of progesterone that's made in our vegetable capsule. So really you just have your active ingredient in there and it's in a capsule that's clear, nothing else that's going to be bothersome for you. Low-dose naltrexone, or LDN, is one of our rock stars when we think about long COVID and we think about mast cell activation syndrome, because it has such a wide application of uses, but primarily it's a mast cell stabilizer. It helps to calm down the mast cells and say, hey, it's all right. You can kind of back off a little bit, pump the brakes. Everything's okay here. We're just overreacting. Also, it helps to decrease the immune system's inflammatory response on its own healthy tissue. So when we think like Hashimoto's and things like this is why LDN is helpful. It helps to stop that self-attack on our own tissues. So Amlexinox has probably been the star of the show for us in 2024. This is one that I do take myself. It's an excellent mast cell stabilizer. It's been around for a very long time and only available at compounding pharmacies. I think there's only a couple of compounding pharmacies around the country that offer it. And we have seen really good response in our patients for helping to calm down the mast cell symptoms, improving a lot of skin issues too, like hives, eczema, rashes. For me, I use it for bronchospasms. So bronchospasms is when the lung tissue reverberates or kind of vibrates or causes some of that kind of constriction and opening because of the tissue being inflamed or irritated. And that's why we give an inhaler. Now we have a lot of patients on MCAS that might be on 3 or 4 inhalers. But what's neat is we've been able to bring people off of their inhalers by using Amlexinox, because it works a bit like a steroid would, but it doesn't affect the body the way steroids do, meaning spiking cortisol, or increasing weight sometimes, or causing other types of inflammation, or needing to wean off the dose. So it doesn't have those types of properties. It's very old, it's very safe, it regulates the immune system in a way that helps to also calm down that histamine release. So I use it for bronchospasms. We have some other nasal sprays that are available if you've ever been tested for MARCoNS, which is a multiple antibiotic resistant staph infection that happens way deep in the nose. And a lot of times, I mean, that's very dangerous because it's very close to the brain, but we have products that we can use that help to eradicate that and get that infection out. So as we wrap up here, I want you to know that if this sounds like you, or if you have a diagnosis of MCAS, or if you know someone that does, or know someone that you think that does, just internalize this. You and your physician should understand the following. Mast cells are not the bad guys. Symptoms, as you're being treated for MCAS, are expected to improve from baseline. And also the treatment will have to be individualized, but much of it is actually dependent on trial and error and really trying to achieve the best possible dose. It's unlikely for you to feel perfect or even significantly better all of the time. This condition vacillates for sure. The process of recovery may take years because you didn't get here overnight. You don't get out of the tailspin overnight either. Several medications may be required to achieve symptom resolution, but I explain treatment of mast cell activation syndrome as a vertical treatment. And what I mean by that is these types of people are very reactive to a lot of things. They don't tolerate a lot. So when we find something that works, we need to increase the dose on that and utilize that as our friend rather than trying a bunch of different things. And we usually find that those with mast cell activation syndrome require higher doses anyway. Lifestyle changes are absolutely crucial. I'm talking nutritional, I'm talking activity. You have to establish a common goal with your physician, because unless they have MCAS, they're probably not going to understand you and your body, because you're living in your body, right? So it's important to choose someone that's going to meet you where you're at. Now, supplements and medications are designed to help, not to hurt, but just about everybody that I have counseled as a patient that already comes to me with a mast cell activation syndrome diagnosis is very wary to start any prescriptions because they've had such poor experiences with them in the past. Many people have been landed in the hospital for extended periods of time, and it's very scary. So let's remember we have to choose the right ones and why. So consider steering clear of some bothersome inactive ingredients, which are usually causing the problem, not actually the active ingredient, but the inactive ingredient itself, like the filler. Or depending on where you're at or who your physician is or where you're being seen, you can actually be muscle tested by somebody who can tell if you're reactive to those inactive ingredients or not. But ones that you want to look out for, if you have MCAS, are magnesium stearate, which is probably the most common inactive filler in every single supplement. So you want to be able to be sure that you are choosing brands that don't use mag stearate in them if you have an issue with it. This goes really overlooked, which is why people think, I can't tolerate it. I can't tolerate it. I can't tolerate the XYZ supplement. It's not the active ingredient, it's a supplement. Be looking at the inactive ingredient. Also, artificial colors and flavors, cornstarch, dyes, potassium sorbate, sodium benzoate, talc, and titanium dioxide is another really big one too. So I've got my references here, and I want to thank you guys so much for your attention. I did put my email address and the phone number in the chat as well, but here is my email, our website. For anything that you saw here, if you'd like to request a prescription for it, anything that comes from the pharmacy does still require a prescription, but you can always call the pharmacy and we can facilitate that for you, or speak with your physician to get on track about the right dosing. And if you're not already a guest with us, then we do offer complimentary wellness consultations through Hotze Health and Wellness Center, and they'll take great care of you. You can talk through the symptoms that you're experiencing to see if you'd be a good fit, and we'd be a good fit for you to be able to help you with some of these symptoms that we talked about this evening. So I'd love for you to save the date for our next webinar, which is on November 14th, where I will be discussing methylene blue. So I'm going to go ahead and stop sharing now, and I'm happy to take any questions that we might have. Looks like we have someone that says, I have canker sores occurring basically every 2 weeks. This has gone on for the last 8 years. Nothing else is wrong with me other than Hashimoto's thyroiditis. I take MP thyroid, which is my only medication. I have a holistic practitioner and she cannot find a cause of this. Literally, I have had tons of tests. Yeah, so this is a very common presentation like we're talking about. And I'm sorry that you've had to go through that because it's very frustrating. It's very timely. And I understand that's a big investment as well. When you're testing and you feel like you find nothing. Well, what I would say is, especially because of the Hashimoto's thyroiditis, is there's definitely an immune system component to it, of course. With canker sores occurring, that is one of the main indications that the tissue in the oral cavity is being broken down and you're being immunocompromised. So one of the main issues I see there is the self-attack or the attack on your own tissues. Now, if you're not already on low dose, well, you're not on low dose naltrexone because you said your only med is NP thyroid. That will be your best friend, likely. And so the goal is that we may need to use some of these prescriptions to get you by as we unwind the inflammation and the damage and the trauma to the cells that have been done for all these years. So there's something that perpetuated that, even if it's not obvious. So I would definitely have a discussion about low dose naltrexone. And if your physician needs to call the pharmacy and we talk about that further, or if you want to call me directly, you absolutely can. Then we can do that. Okay, so you're saying you've been on LDN and it caused a lot of hair loss. So what we would need to do is be sure that we find the right dose for you, or that we are addressing a different part of the immune system. And so maybe it is mast cell related. There's obviously so much more that we need to look at on an individualized basis to see, but we want to get to the root cause of what is actually stirring up the immune system. So I think that maybe having a conversation about nutrition, not that they're good versus bad foods, because that's not how this conversation goes. It's, are we eating foods that are aggravating your body, causing inflammation? Are they high histamine? Are they not being favorable to the gut? There are several slides that I've taken out of this particular presentation because it's just very bulky already, that talk about the approach for physicians to evaluate somebody that comes in and looks like they have a mast cell activation syndrome presentation. And a big part of that is looking at the gut, and also doing some tests too, which you've had plenty of tests, but we want to be sure we're screening for parasites, we're screening for H. pylori, and we have a diverse gut microbiome. Also, we want to be sure that if you have Hashimoto's thyroiditis and you're not on anything else to bring down those antibodies that self-destruct the tissues, that also needs to be addressed. So like I said, you can feel free to call the pharmacy, call me, email me, and we can definitely discuss further and kind of pick apart maybe what we think is what's going on, or maybe we can uncover some information that can be beneficial to your physician as well. Also, someone asked, is it possible to get a copy of the slideshow to share with your functional medicine doctor? Of course you can. My email is here in the chat. It's my first and last name, Bryana.gregory@physicianspreferencerx.com. Or you can send me an email and I can send you the copy of it. You're going to get a copy if you attended anyway, but if you want to send me a note or anything, you can to my email address. So some of the questions I usually get to are around pricing, and we are at our 1 hour mark. So certainly if you have any questions about the pricing on any of these products, please let me know. We always want to be sure that we're keeping it the most cost effective for you as we customize an approach that makes sense that we are able to get symptom resolution for. So I want to thank you guys so much for your attention this evening. It's been a pleasure speaking with you about something that I am very passionate about. And it's just great to see people really improve with some of these lifestyle changes, supplements, and also compounded medications that we can offer. So please let me know if you have any questions, and we'll see you guys next time. Take care.